Hello, my name is Karen Blankenship. I'm a doctoral student at Florida Atlantic University and an active nurse practitioner. You can find my blog on the web at healthycomm.net. This is the fifth educational session in a series of 6. The title is Vitamin D and Health. As stated in the last educational session, vitamin D is quite important for healthy bones and immune system function. Vitamin D helps regulate the supply of calcium to the bones and to all cells. In addition to the classic role in bone homeostasis, vitamin D may protect against high blood pressure, cancer, inflammation, and other diseases. According to Muir and Montero Adasso 2011, vitamin D deficiency has been associated with poor physical ability, decreased muscular strength, muscular weakness, cognitive deficits, falls, fractures. In a meta-analysis, Schuster 2010 reported that low vitamin D serum concentrations were associated with osteoporosis, muscle weakness, cardiovascular disease, metabolic syndrome, multiple sclerosis, mental defects, and many cancers, in addition to many other disorders. In other studies, calcitriol exerted significant activity against tumors in human prostate carcinoma, breast, colon, and pancreatic cancer, as well as in leukemia, myeloma, and lymphoma. The mechanisms by which vitamin D prevents disease are not clear. The active form of the vitamin in the body is 1,25-dihydroxycholecalciferol, or calcitriol, which is released into the blood from the kidneys and which is made within some cells for use by those cells. Receptors for calcitriol are found in many tissues: intestine, bone, kidneys, heart, muscle, pancreas, brain, skin, colon, prostate, breast, hematopoietic system, central nervous system, and immune system, suggesting that these tissues all require vitamin D for function. It is also known that vitamin D activates more than 900 genes in the human body. It is speculated that these genomic effects of vitamin D influence cognition, mental health, and are one of the means by which vitamin D helps protect against cancer and other disorders. Vitamin D is unique among the vitamins in that it can be made in the body with exposure of the skin to the ultraviolet rays of the sun. Exposure of the hands, arms, and face for about 10 to 15 minutes in the sun a few times a week here in the southern United States is all that is needed to prevent vitamin D deficiency. However, at latitudes above 35 degrees, which is an imaginary line from Boston to the Oregon and California border, and in winter months, less UVB reaches the Earth's surface, which results in less vitamin D production in the skin. UVB light is blocked by clothing, sunscreen, and glass in windows. Further, older individuals with diminished organ function, especially kidney, and those with darker skin color and higher amounts of melanin in their skin require longer sun exposure than those with lighter skin, as UVB is blocked by melanin. So one cannot always rely on the sun for attaining adequate vitamin D. Vitamin D can be obtained from foods. However, not very many foods contain the vitamin. The vitamin D3 is found naturally in fatty fish and their oils, such as herring, salmon, tuna, and sardines. Whole milk, eggs, cheeses, butter, and some margarines also contain the vitamin, but in lesser amounts. Additionally, fortified non-fat and low-fat milks, as well as soy and rice milk, provide the vitamin. Look for other foods which are sometimes fortified or have added vitamin D, such as orange juice and breakfast cereals. The main food source of vitamin D2 is shiitake mushrooms. Please remember that both vitamin D2 and D3 function in the body in the same way. It is also helpful that vitamin D is fairly stable and not reduced in cooking or processing. How much vitamin D do we need? The recommended dietary allowance for vitamin D is 600 international units, or 15 micrograms, for children, adolescents, and adults, including women who are pregnant or lactating, up to 70 years of age. The recommendations for adults over 70 years increases to 800 international units, or 20 micrograms. Optimal blood vitamin D concentrations, measured as 25-hydroxy-vitamin D, are not clear. However, concentrations of about 30 to 40 nanograms per milliliter in the circulating blood are considered sufficient for health. Blood vitamin D concentrations less than 20 nanograms per milliliter are considered deficient. It is estimated that the blood vitamin D concentration increases by 1 nanogram per milliliter for every 100 international units intake of vitamin D. Therefore, to maintain 30 nanograms per milliliter, intakes of about 1,000 to 2,000 international units, which is 25 to 50 micrograms daily, may be necessary. Daily intakes of the vitamin appear to be more effective than doses taken weekly or monthly. Many researchers claim that a widespread epidemic of vitamin D deficiency is plaguing North America. However, the Institute of Medicine's committee of 14 scientists reported that the majority of persons in the United States and Canada are getting enough vitamin D and calcium for bone health maintenance. Given the widespread functions of vitamin D in so many body systems and studies linking poor vitamin D status with a multitude of disorders, we must consider the individuals who may be at risk, such as those who avoid the sun or always wear sunscreen, older adults, those who don't consume fortified products, and those who don't consume fish. Is there a risk of toxicity? Vitamin D toxicity typically does not occur from exposure to the sun, as the body regulates the amount made in the skin. Instead, the problem is most likely to result from the overuse of supplements. Vitamin D toxicity is usually seen with vitamin intakes of 10,000 international units or more daily over a period of several months. Toxic effects of such megadoses of the vitamin damage kidneys and other soft tissues secondary to calcium depositions. As a result, toxicity also may lead to hyperphosphatemia, hypertension, and renal dysfunction. Toxicity also has been associated with anorexia, nausea, weakness, headache, depression, and even death. Suggestions. Consider the least healthy food you eat every day. Identify at least one food that could be a healthier substitute with just as much satisfaction. Can this healthier food substitute also provide some vitamin D? Remember, adults need 600 international units of the vitamin daily. And remember to choose whole foods over supplements, as supplements do not give the same benefits as a healthy diet. Plan to make healthy selections when eating out, perhaps salmon instead of steak, as a 3-ounce serving of sockeye salmon delivers 447 international units of vitamin D, whereas beef, pork, and poultry have very little of the nutrient. 3 ounces of tuna fish provide 157 international units of vitamin D. Fortified orange juice has 137 international units of vitamin D in 1 cup. 1 cup of milk equals 1/4 of your daily vitamin D needs, or about 150 international units. Many yogurts are fortified with vitamin D. Heavily fortified granola may provide a rich topping for that yogurt. 1 large egg supplies 41 international units of vitamin D in the egg yolk. Can you count how many vitamin D-rich foods you eat in one day? If it is only 1 or 2, you may be deficient. Remember, you can turn your face, hands, and arms to the sun for 10 to 15 minutes per day to increase your vitamin D status. Given what we now know about vitamin D, it is important that we comprehend the note of encouragement towards sufficient vitamin D intake, making healthy food choices, and absorbing this sunshine vitamin. And remember to promote this health behavior to your family, friends, and the community. I want to thank you for watching and invite you to read the corresponding articles at healthycomm.net.